Hi, I'm Sydney Rowe, and I will be presenting my BSN Educated Citizen portfolio. My public issue is about opioid use and abuse. The use and abuse of opioids has been an issue for many, many years, although recently is when it just became a bigger, more known issue. A lot of people knew it was an issue, but it just wasn't in the public health, public safety spotlight, I should say. According to the Department of Health and Human Services, in 2019, 70,000 people died from opioid-related overdoses, and 1.6 million people admitted to having an opioid use disorder. The use and abuse of opioids definitely affects anyone, everyone. Does not matter demographics, whether you're Black, white, Christian, gay, Muslim, Indian, whatever. It can affect anybody from all lifestyles. I chose this topic because it is such a large-scale problem in our community, in our country, and not enough people really choose to talk about it or bring it to light, especially in nursing school and in the area of life that I'm in. And truly, I believe the only way to actually make a bigger impact with this issue is to communicate and spread awareness. Not that we haven't done that before, but we need to do it on a much larger scale. To define an educated citizen is a competent practitioner and an engaged citizen who responds productively to the complex dynamics of the world, utilizing a diversity of disciplines and perspectives. In relation to opioid use and abuse, as an effective communicator, about 1 year ago, I had to spend a few weeks of clinical at Community Alliance, and it really brought to my attention not only how many individuals were there to receive help, but how badly they actually wanted to receive help. I just thought it was pretty cool how many people were actually there getting help and wanted the help that they were getting. I learned that opioids can really affect anyone and everyone. When I was there, I saw so many different people, so many different kinds of people who are utilizing Community Alliance and all the programs that they have. A lot of people had mental illness, but a lot of other people also had substance abuse disorders. Another experience related to this would be in clinical, just on the hospital floors. Calling the doctors can be super nerve-wracking, especially to clarify or question any orders. In relation to opioid use, I would say that many of these individuals are our patients in the hospitals, and whether it is questioning why the pain medication is being given or asking why the dosage of this oxycodone is the dosage that it is. It can help us nurses and the patients to better understand why they are being given the narcotic, or to say, hey, I don't want that. I've learned that it's really scary and nerve-wracking to question these things, but it definitely needs to be done. Inquiries need to be made in relation to opioids and other medications that can be abused, because most often it really does start with us. Usually, if somebody is telling you they have an opioid problem, they may say, oh yeah, I had this knee surgery a while back and now I just cannot stop taking the medication. It's very easy for people who are taking these pain medications for chronic pain or just post-surgery to have a hard time stopping using these things. That is relieving all of their pain. In regards to effective communicator, I have learned that communication truly is the key in healthcare. In relation to opioids, like I said previously, it is important to question anything that you are unsure of or seems off, and to talk with the doctor and providers and the patient to see if they have a history or use or abuse, any allergies, have they ever been exposed, do they have family members who use, etc. These are important questions and important information to have, because most often patients are prescribed opioids for post-surgery pain or chronic pain, like I said before, and then they become addicted, and it is started with us in the hospital. We need to communicate in order to start going in the right direction of reducing opioids abuse and overdoses. I think everything really starts with communication. Being a reflective individual, as stated in the previous slide, I got to go to Community Alliance this past year for one of my clinical experiences. And in regards to being a reflective individual, Community Alliance definitely made me reflect after each visit that I had. I learned a lot about different mental illnesses and disorders, combined with substance abuse disorders, how people deal with them. And the most eye-opening thing for me was to see how many people actually attended and how many of them actually participated, like I said in the last slide. It was just crazy to see that people actually wanted to get help, because oftentimes people just want to be stuck in their ways and not get the assistance that they need, or they can't. Maybe it's just not offered to them in the right way. So from that, I would go home after these clinical days and just think to myself about the different programs they offer, the people I'd met, and just reflect on my whole day that was spent in this facility. There's so many different programs, there's so many different people, there's therapists, there's doctors, there's nurses, social workers, case managers. Just, I would come home and I would reflect on all of the people I met, all the things I saw, everything I learned. And I definitely think that was one of the biggest experiences in nursing school that helped me grow into being a true reflective individual. For the second thing, in relation to opioid use and abuse, I have become a reflective individual by always paying attention to my patients' medications. I make sure to always know the 5 rights, which is right person, time, route, medication, and dosage, and to clarify anything I may have a question about, either with another nurse, the pharmacist, or a provider, etc. Medication errors definitely happen, and I don't want that to happen to me. I have learned the adverse outcomes of what can happen when a healthcare professional does not check or is missing one of the 5 rights. And if that happens with an opioid medication, it can have devastating consequences like an overdose, or the patient can become addicted. So to avoid that, being reflective and knowing the medications you are giving can stop that from happening. Essentially, overall, I have learned that being a reflective individual in the healthcare field makes your job so much easier, and it truly makes everyone else's job easier. Reflecting allows us to recognize areas for improvement, identify and fix mistakes, and implement the changes we need. I will carry the idea of being a reflective individual with me throughout my nursing career and into my personal life for many years to come. Change agent. I have implemented many ideas, whether it was at school, work. I used to work as a CNA. I think I'm a very innovative person. I'm always looking for new ways to improve or make things easier. And I've recognized that although there's a lot being done to spread knowledge and awareness about opioids, there's definitely a lot of room for improvement. Being a change agent in relation to opioids, personally, I will continue to try and educate my patients and share my knowledge as much as possible in my career. I don't know how many changes I could personally make at this level, but I know going forth in my career, it will definitely be something like a goal of mine to make an impact in the opioid crisis. Many of my clinical sites have been in low-income areas around the metro, and in relation to opioids, it has allowed me to see many people who are impacted by using, or a family member who's using, or a friend who's using. In relation to being a change agent, going to these clinical sites also allowed me to not only recognize what is being done for these individuals, but where improvements need to be made and change needs to happen. I noticed one thing that really needs to change is how we are spreading awareness. Social media, websites, handouts, they're very good ways to reach people. I just feel like we're not reaching most of the target population, I guess. An idea I have is like maybe to implement more places like Community Alliance and advertise those places a little bit bigger. I think the hotlines, the websites, all of those things are really, really helpful. But like having a physical place to go to, a safe place to go to, is really important for these people. I have learned that being a change agent is a very important quality to have, not only in the hospital, but in all areas of my life. Going to different clinical sites, seeing how different people and different places do things has helped me develop this quality and grow into it. I like to look for areas of improvement. I also know that not everything needs improvement. But I do continue to look for ways to make life easier, to make my work better, more efficient, more accurate, etc. I will definitely carry being a change agent and being innovative and just producing a lot of new ideas through nursing and through my personal life as I grow up, have a family, and all of that stuff. In conclusion, opioid use and abuse has been and probably will be an issue for many, many years. But as healthcare professionals, the awareness, the education, and the assistance pretty much all starts with us. I will carry the qualities of being an effective communicator, reflective individual, and change agent throughout my nursing career to provide the absolute best care that I can offer to my patients. And then references. Thank you.